the new WCEG Network on WCEGTalkRadio.com. Click Livestream tab or watch us live on your smart TV, YouTube at WCEG Network. I am Celeste Giordano, your show host, along with my co-host, Lisa Parks with ImageCon, who's filling in for Sarah Poe. We are the global legacy and wealth building for the next 1 hour. We're the worldwide community empowerment group where we speak life into the community. Like us on Facebook, follow us on Twitter, and on Instagram at WCEG_talk_radio and at WCEG Network. And last but not least, our disclaimer, the topics and opinions are those of the show host and guest and not WCEG Network. Thank you for your continued support. Well, hello, ladies. How are you tonight?
Doing well.
Doing well. Well, Lisa, thank you so much for filling in for Sarah Poe. And, you know, it's a tax deadline. We're in the last 7 days. And so we really appreciate you filling in not only earlier at the end of April, but you also filling in tonight for Sarah. And we have a very special guest with us tonight. We have Bonnie Dobbs with Medicare and the Other Red Tape, and we're going to formally introduce her. But Bonnie, we're so glad to have you with us tonight, and this is going to be a very powerful hour about Medicare. And what I'd like to do first, Lisa, is I'd love for you to tell us your name, how people can get a hold of you, and a little bit about yourself as a co-host.
Well, good afternoon. I'm Lisa Parks, and I own a company, ImageCom Group. We work in search, social, content, and local. You can learn a little bit about me at www.imagegroup.com. And if you want to reach out, you can just email me, Lisa Parks, Parks, at imagecomgroup.com. I'd love to chat with you.
Absolutely. And again, I'm Celeste Giordano with Celeste Giordano Coaching at www.celestegiordano.com. And I am so glad to be here with you, Lisa, and I'm excited to get started and to interview our friend Bonnie Dobbs. Wouldn't it be great if we could find someone who truly understands the Medicare process? You know, I turned 65 in March, and I still have not signed up yet. And it's because it's so very confusing. I'm going to share some of that with you tonight. But Bonnie is someone we can trust to help us make this important decision with a free consultation. Our guest today is Bonnie Dobbs, founder and owner of Medicare and Other Red Tape, LLC in Atlanta, Georgia. Just after obtaining her insurance license, a member of Bonnie's family developed Alzheimer's. While visiting him in the nursing home memory care facility, Bonnie found families were very confused about Medicare. She chose then to specialize in Medicare and has become an eternal student dedicated to helping the aging community, which is very much needed. This opened opportunities to share her knowledge with thousands of people through classes, seminars, workshops, and panel discussions. Bonnie has written articles for Ask the Expert and the Atlanta Journal-Constitution and is the Medicare expert that sits on all the AJC's Aging in Atlanta panel discussion. As a broker, Bonnie Dobbs is contracted with all the major insurance carriers and probably some we've never even heard of. She has a team of 17 agents active in several states. And without any further ado, Bonnie, we are so glad to welcome you to the show tonight. And this is going to be a powerful hour learning all about Medicare, and we just appreciate you joining us tonight. Is there anything that I left out in that introduction that you would like to share?
No, I think you pretty much covered everything there. You're right. It's Medicare is so doggone confusing. And so I really appreciate you having me on, Celeste. And I look forward to talking to you also, Lisa. I don't think we've met, but yeah, so thank you. And I hope that I can break down everything in a simple manner so our listeners will be able to understand this, and they can always, contact me if they have particular questions that they think is just for themselves or general questions.
Absolutely. And, Bonnie, and I just want to say, I just want to thank Penny Rogers with the WCEG Talk Radio for allowing us this platform and this opportunity to bring this wealth of information to our listeners and our community, because it is much needed. And, I'm sure there's a lot of people out there that have called with this pandemic and trying to get in touch and not being able to meet in person, and have made 10 different phone calls and got 10 different answers on Medicare and Medicaid questions. So, I just appreciate WCEG and their role and for allowing us this opportunity. Bonnie, first, please tell us more about why you chose to specialize in such a confusing program.
Well, you're absolutely right. Nobody wakes up one day and go, I want to be a Medicare expert. I mean, you may wake up one morning and want to be a fireman or a policeman or a nurse or a doctor, but nobody says, I want to be a Medicare expert. So it actually happened by mistake. It's interesting how sometimes whenever we're just going through life and not really paying attention to our path, how things just kind of come up in front of us. And that's the way it was for Medicare. So I got my insurance license in 2007. And I was just going to do under 65. And before I could ever really write my first policy, a family member developed Alzheimer's and was in memory care for all of 2008. And so every time we would go just about to visit him, someone would bring up their insurance and they couldn't understand it. And I'm thinking to myself, how confusing can insurance be, And one night I'll never forget, after we had been over to the nursing home, Miss Miller said, I just don't understand this Medicare thing, because one family will come in and say they feel like they're getting nickeled and dimed to death. The next family will come in and say they pay this huge monthly premium, but then they don't get any bills. And she said, but the most confusing thing for Mason and I is we don't pay for anything. And I was like, man, you're right. This Medicare thing is a real suspenseful nightmare thing out here. So I just kind of started checking into things at that point. And then Mr. Miller passed. And so he passed in December. And by this time, my son had graduated college in Atlanta here. He went to Kennesaw State and was going to be moving down to St. Augustine because he was getting his doctorate in physical therapy. So here it is, January, we're moving him down there. And every day I see this man sitting outside sunning himself. So you know how it is the first time you see somebody like that. The first day it's hello, the next day how you doing, the next day great weather. And then about the fourth or fifth day into it, I said, I wish I could do something so I could be down here in Florida in the winter and be in Georgia, the rest of the year with my family. And he said, do you have your insurance license? And I said, yeah, as a matter of fact, I do. And he said, have you ever thought about Medicare? I said, it's the only thing I ever thought about. So it's just how I got introduced to Medicare. And then I went over that night, had a glass of wine, we talked about it. And when he started talking about it, it made so much sense to me, but only because I was reflecting on what I had heard going into the nursing home, that the different ways to get coverage made sense. And let me say this so I don't forget. I'm sure everybody's wondering, well, why didn't Mr. Miller have to pay anything? He was career military. And if you have TRICARE, they pay for everything. You don't want to enroll in an individual plan because if you do, you're going to subject yourself to co-pays or co-insurance. So if you have TRICARE and you're listening out there, just call TRICARE and stay with what you have. You've got great insurance. And thanks for serving our country.
Absolutely. Thank you so much for that, Bonnie. We do appreciate all of our veterans and things that they do for our country. So I understand you're the Atlanta Journal-Constitution's expert panelist on Medicare. What are the most important points you share in your seminars, and would you share them with our audience tonight?
Sure. So, you know how sometimes you feel like Albert Einstein and other times you feel like Forrest Gump? Well, that kind of describes Medicare, because some things make sense and other things make absolutely no sense at all. So the first thing I always try to do is start at the beginning of the beginning. Like, how do you get Medicare? What does it pay for? What do you have to pay for? How does it work with a plan? What are the different ways to get a plan? But most of all, I try to put things in simple terms that are understandable. That is foremost, because, you know, some people, when they get a little bit of education in any particular realm, okay, they try to talk shop, and, you know, we don't know that what a SEP from a SOA is. You know what I'm saying?
Right.
I can talk about that with my agents, but not whenever I'm giving a presentation. I mean, I want people to fully understand exactly what it is. So that's one thing. It's just putting things into understandable terms. The other thing is going over penalties, and how to avoid getting a penalty, because what it says in the book is penalties are for as long as you have Medicare. Well, how long are you going to have Medicare? For as long as you live, right?
Right.
So that's how long your penalty would be should you incur one. So that's really important for me to explain. And then there's so many different times that you could get a penalty in all the rules. So that's really a big deal for people to understand.
Lisa, you have some questions for Miss Bonnie?
Yeah, and this is kind of a simple one. You know, when I turn on the television, I see a million different commercials, and they all talk about low rates, great benefits, and Part A's and B's. And how does a person choose? I mean, what do I do?
First of all, those plans remind me of show me the money, right? And, because they all say, you know, we can offer dental, vision, hearing, and we'll come over to your house Tuesday night and cook dinner and walk your dog. You know, I mean, it's just so doggone unrealistic, you know. And most of those commercials are very misleading because they say that. First of all, in order to get that Part B back, or the $148.50 that people are talking about, is you have to qualify, and that's income based. So you have to be low income, meaning that your income is probably like $1,000 or less per month if you're single, and you can't have more than like $2,000 or $3,000 in a savings account. So they don't say all that.
Right.
You know, they just want you to call that number, and then they're going to come up with a way to write a plan, whether it's a good plan for you or not. So that's one thing. The other thing is some of the plans, some of the Medicare Advantage plans do have the dental, vision, and hearing plans built right into them, but you have to, outside of open enrollment, or annual enrollment rather, which is October the 15th until December the 7th, which is really important time frame, because during that time you have the option to review your plan, compare all the plans for the following year, and change plans. Outside that, you need what we call an SEP, or a special election plan. Some people a special election period. Some people call these life-changing events, okay? So if you have one of those, there are times outside of annual enrollment whenever you can change plans. So that's those commercials, that's the people they're after. It's the low-income people and the people that would qualify to change plans at any time. Some of the Medicare supplement plans, do offer dental, vision, and hearing discounts, and some of them do offer a gym membership, which is, that's kind of cool to be able to do away with that monthly premium. So some of the MedSup plans also offer either silver sneakers or silver and fit is one of them also. So those commercials are very misleading if they're general. And if they're one specific company, then that narrows your choices tremendously, because that would be just like going to Toyota. You know, if you go to Toyota, you're there to buy a Toyota. You're not there to buy a Ford. So if you go to Toyota, they're going to sell you a Toyota, right? So if you call a specific company, it doesn't matter what plan you may need, they're going to put you on a plan that they offer.
Okay.
So yeah, so watch those commercials carefully.
Well, you know, that makes a lot of sense right there, Bonnie. And I mean, you know, we're bombarded with things in the mail, and you know, you get all the flyers and things of this nature, and the phone calls, and like you say, you've got to be very, very careful. And people that have insurance, they should be contacting their insurance first, shouldn't they, to know what benefits they have once they turn 65? Would that
Oh,
not
that's
be?
such a good question. That's kind of what I just said. If you are turning 65 and you have a company plan, say you work for, I don't know, a corporation that offers plans, okay? If you call that company, they're going to only tell you what they have to offer. So that's the reason why it's better to use an individual agent, okay, a broker, rather than to call a company, because a broker, they are professionals. They do this every day. They can shop all the plans available to you in your service area. Whereas if you just call one company, they're only going to be able to tell you about the plan that they offer. They can't compare, and they're not going to, you know, they can't compare all of the different plans that are available to you. And what many people don't realize is up until this point, until you're Medicare eligible, we've all had a family plan through your work, right? So you just, each household or each family decides from whatever their company offers, you know, plan A, B, C, or D, and then you just decide which one works or which one you can afford, usually, you know, which one has the lowest premium and the highest deductible. Okay. So now all of a sudden you're Medicare eligible, and Medicare plans are different because Medicare plans are all about you. So if I go into someone's home and I'm talking to a husband and a wife, okay, I may put them on 2 different plans. As a matter of fact, if I line up 6 people, I may put every single person, maybe with a different plan, a different company, okay? Because your husband does not go to your gynecologist, right? That's right.
Right.
You are not on your husband's medications, right? Your health may be great, and for the purpose of this, we'll say his health is not great, okay? Now, if let's talk to a bunch of men, we do it the other way, okay? So Medicare is all about you. So what we do is we find out all the information about you. I have a form, and I call it my discovery form, and I send that out to everybody, and it's 2 pages. You know, I always say, by the time we get through, I'm going to know more about you than you know about you. Okay. But that provides the information that I need. Once I get those back, I always look everything over. If I have any additional questions, which I usually do, then I call you up, ask you whatever further information that I may need. Then I take on the task of researching every plan in your service area. And we come up with the options, have an appointment, go over those options. But before I actually go over those options, I call it a little mini class, just your personal class, where I go over once again how you get Medicare, what is the definition of each part of Medicare, what it costs you, your options, the two different ways to get your coverage. How is your Medicare going to work with your insurance?
Yeah.
Because if you don't have a good understanding of all of those things, then you're going to be lost, and you'll be calling me all the time because you don't understand it.
Absolutely.
And I always say, when I get off the phone and once we've chosen the plan and it's off to processing, I'll say, once we get off this phone, you may not be able to stand up and recite what I just said, but you'll be able to look at the information and go, oh, I remember she said this here, she said that there, and so you'll know exactly where to go to get your information. And I think the best consumer, I know this is cliche, is an educated consumer, always. And that's what I try my best to do. Make it simple. What is it? KISS. Make it simple, silly.
Yeah,
Right?
Yeah. Keep it simple. Yeah,
Yeah,
absolutely.
there we go. Keep it simple, silly.
Yeah.
And and so you understand exactly what you have.
Well, and Bonnie, I consider myself a very proactive individual, and I knew in March I was turning 65, and I started educating myself way before that.
Sure.
And I called. We have great insurance through my husband's work, and I called 3 different times, because the very first time I called, I got an answer that I thought, that doesn't sound right. I called back again. You got another answer. So I got 3 different answers every time I called our insurance company to ask about that. And then I remember speaking with you and I had a consultation, and you said, you advised us, talk to the health and benefits. Well, another thing that I ran into with the pandemic, not everybody at your corporation is answering the phones to be able to give those answers. And so, it's just when you start getting different answers, I was getting very confused. I was getting frustrated. And it's like, I don't think I could trust anybody that I'm talking to about Medicare. That's exactly what I felt.
Yeah.
But so I totally agree with you. That leads up to this next question. And I'll ask this, Lisa, and I'll let you ask the next question, is what are the advantages you provide to clients as a brokerage versus individual agents?
Well, as a broker, okay, and I teach all of my agents. I now have 18. I'm in the process of teaching. Actually, and I've got another one coming on board. So I'm in the process of teaching a couple of new agents. But the first thing I make everybody do is get contracted with all the carriers, because you cannot or give a client the proper needed service unless you're in a position to compare all of the plans in their area. So that's the first thing I do, is I get them contracted with all the carriers, and then I teach them step by step. So whenever they start working with the client, all they know is how I've taught them to do this in a very methodical way. I always say I only give you one piece of homework at a time, and that's on purpose. Okay. First of all, I don't like to be overwhelmed, and I'm sure seniors don't like to be overwhelmed. Heck, nobody likes to be overwhelmed, right? So if I give you one piece of homework, you can go do that. And when you do one thing at a time, you learn that part. Then we'll go to the next piece of homework. So by the time we start and we get to the actual enrollment, it's made sense, because you're like, okay, so now we got to go enroll in this part. And now she's got to have all this information. Now she's going to teach me a class. And now we're going to do this. all the way through. And the last thing is, oh, and now she said Carol's going to call me and give me my member ID number. So it's like, oh, wow. I try to just take this monster and make it simple. And I teach all of my agents to do the same thing. So whether you're talking to me or one of my agents is handling it, you're going to get the exact same thing, which is a lot different from like what you said, like calling somebody in HR. You got 3 different answers. Did you know you can call somebody at these insurance companies and you can get different answers? People that call you on the phone, that solicit you, that sends you mail, that cost you, whenever you're in the grocery store,
Yeah.
because some of these people get very aggressive, but they can give you wrong information. I mean, I listen to every time I see somebody on Facebook and that they sponsor one of those ads, I'll just listen to some of the stuff that they say just to check in. You know what I'm saying? I am so amazed at how right on Facebook they're giving wrong information.
Really?
I think the thing that really got me more than anything, though, was probably it's been about a month ago now. I have people that live in other countries that when they move back into the U.S. or when they're getting ready to move out of the U.S., they will contact me. So I had this guy from Roatan, and he was like, okay, so I've lived in Roatan. That's an island off of Honduras. He said, I've lived in Roatan for 11 years. I'm 67. I want to move back to the States. I've got a spot on my lung and I want to go to an American, hospital. So he wanted to go to MD Anderson. And he was like, how do I get my Medicare started? So without a penalty, that was the whole thing. So I told him what to do. He called Social Security, and God is my witness. The guy he talked to at Social Security asked him for my name and my phone number. This guy called me and he said, where you get this information from? And I said, I don't know. I've been doing this for 11 years. This is the information I've already got. I mean, I've always given out. I've been doing this for so long. I'm on an automatic pilot. I just spit it out. I don't go look it back up again, right? He said, you need to tell me this. And I said, look, you work for Social Security. I'm just some little insurance agent over here in Georgia doing my little thing. So why don't you go ask your supervisor how you handle it when somebody is moving into the country?
Wow.
I mean, I could not believe that. I could not believe that. So he and my client eventually he learned what he was supposed to do. And now my client is going to be coming over next month and we'll be able to start his plan. But when you say you call and somebody gave you erroneous information, it happens all the time. And it goes back to the very first thing we said in the beginning of this. Medicare is so confusing. People don't understand it. And the information they have, they're usually reading from a script. And if you ask them a question that's not on that script, they'll just sometimes give you any kind of answer just to get you off the phone or to make them look like they know what they're talking about. So
Absolutely. Lisa, we've got a couple of questions from our audience that I'd like to read if I could, and then I'll let you pick up. But I do want to tag something since you mentioned the Social Security office, Bonnie, is I also had an incident with that to register. And of course, they weren't seeing people in person. They were scheduling appointments on the phone. And so I made my appointment on the phone and I called, what I thought was the closest office to me. And it was like 2-3 weeks later for this time. And I'm there with my pen and paper and I'm waiting for them to call me. And they don't call me. And so I pick up the phone and call back to this office that I scheduled this with. And she puts my information in the system. And she says, well, when we put you in the system, it moved you to the town of Norcross, which is nowhere near close to me. And about that time, the phone rang, and with today with scammers and things of this nature, and this is why I'm sharing this, on my phone, it just had a phone number. It didn't have a caller ID. It didn't say Social Security office. It just had a phone number. And then it had a foreign individual, and nothing's wrong with foreign, but it had a foreign individual on the phone, says, I'm with Social Security office out of Norcross. And it's like, no, I have an appointment with this one. Well, no, they transferred you to me. And I didn't feel comfortable, because with people scamming, and they're going to ask me my name, my birthday, my Social Security number, blah, 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 blah. And I just said, I really want to cancel the appointment. And I canceled the appointment because I didn't feel comfortable. And
Yeah.
so.
And that's the whole thing. Speaking of scams, is that's what these people do. They'll call and they'll say, I'm from the Social Security office, or I'm from Medicare. And two recent scams was, remember, you're just becoming Medicare eligible, so you will not remember this, but a couple of years ago, they decided to change from your Social Security number to an 11-digit and alpha number, okay, numeric number, okay? And so scammers were calling people saying, hello, I'm from Medicare. The new card is $20. Let me give you the address. You send it here, and then we'll drop your new Medicare card in the mail. Well, people that didn't know were just sending these people money, okay? And Medicare doesn't charge for those cards, right? That's
Right.
one scam. The latest is, of course, they took advantage of this COVID-19.
Yeah.
So they would say, in order to get your shot, send us $50 and we can put you to the top of the line, and and blah blah blah. We'll send you the address. All we need is your name, birthday, address,
Yes.
and your
And your
Medicare
social-
number.
Oh,
And
wow.
then once we receive your money, we'll send you the address. What is your zip code? So now they've got all of your information, and they make it sound so realistic that people did that. It's horrible. Or sometimes they'll call and say, I'm from the Social Security office, and there's a warrant for your arrest because something's been mixed up with your identification. Please call us immediately with your updated information, blah blah. So there's just always something going on, and I can understand why you felt intimidated when somebody called you, because you were like, is this for real, or is this a scam?
Yeah, and I really wasn't intimidated, but I didn't like it, and I know better, and I have some friends and I have some family that have been a victim of fraud, and it's a horrible thing. And for our listeners, we just want to make sure that you don't give that information out. I mean, please say a sentence or two, Bonnie, about, for our listeners, especially our elderly people and people that have elderly parents, how to advise them, not to give this information out.
The best way is just remember this is a blanket statement. The IRS, Social Security, Medicare, Medicaid, none of those government programs are ever going to call you over the phone unless you have called them and they're calling you back, like what you did, Celeste, okay?
Right.
But since they missed the appointment, you're right, then you could be in a scam. They always contact you by snail mail. So unless you open it up from the mailbox, don't be giving people your information. If you call Social Security, then you have to give them your information, because they really do have to make sure that's you. But if somebody's calling you on the phone and you're not expecting that call, you did the right thing. Do not give them your information, because they're either trying to steal your information so they can scam you out of money, or or whatever. Or a big thing is they want your health information. They want your Medicare insurance, okay? Because they have a chronic disease. Maybe they have cancer or something horrible, and they don't have insurance, and they'll just go in there, and once they find out what your information is, and they'll go to the doctor as you. And that's the reason why every plan that we write, there's a little prerequisite that I have to tell everybody. Please know that whenever we send this application in, that Medicare, that the insurance company is going to check with Medicare to make sure that this is you enrolling in this plan and not somebody fraudulently. Because whenever you write a plan with me, you think, okay, well, that's done simple and easy. Okay. But what happens is whenever I write the plan, it goes to the insurance company. And part of the processing is the first thing they do is go to Social Security and Medicare to make sure that this is you. So if your doctors or your medications don't line up with in your medical history, that's what I was thinking about. Medical history doesn't line up with the information that's given here, they're going to check into it and see, oh my gosh, maybe that this is somebody fraudulently trying to enroll in a plan using your information. So it's really a big deal to enroll in a Medicare plan. In some plans, it may only take 3 to 5 days, but other plans, it takes like maybe 10 to 12 business days for the processing to complete, because they do have to go through several layers, to make sure, like I said, that this is you.
Absolutely. I mean, you want to do your due diligence. You want to protect that Medicare card, protect your insurance card, and it's just very, very important to do that. We even had a thing during COVID that we had a medical kit sent to us, and it's like, we didn't order a medical kit, but it was a data entry error on somebody's part between a doctor's office and insurance that they sent it to us. And, and I had to call them and explain, why did we get this? And we don't go to the doctor in this town here, and we don't know that doctor, and we didn't order this. And, now you're wondering, does somebody have your insurance information or something like this?
Exactly.
And I made them send me an email and to document the whole conversation of what had happened. And they said, well, go ahead and just send this to us. I said, no, I'm not sending you nothing. It's staying right here.
Exactly.
Well, listen, I have about 3 questions. And Lisa, I'm going to ask these questions from our listeners. And one of them, Bonnie, is, why does Medicare penalize you when you don't sign up at retirement?
Well, when you become Medicare eligible, okay, the CMS, who is like the watchdog over Medicare and Medicaid, they have all of these guidelines. So if you're turning 65 and you're no longer working, there's a period. There's 3 months before, the month of, and 3 months after. If you are continuing to work and you're past 65, as long as your company has 20 or more employees and provides Medicare equivalent insurance, then you can continue on your plan if you're an employee, or your spouse's employee plan, until they retire. Once you retire, you got the small window of time to enroll in a Part D plan, which is the prescription drug plan. And if you don't enroll in a Part D plan, you get a penalty. And remember what I said about penalties. They are for as long as you have Medicare. And how long are you going to have Medicare?
Forever, till you die.
There you go. So it's important to work with a broker who knows all those deadlines, and also to make sure that you have continuous coverage. So once you leave your employer coverage, then your Medicare coverage would start the very next day. So you would not be without coverage in the event of an illness or accident.
So you talked about prescription right there. Before I go to that next question, I want to. So what if your spouse is still working and you have Cadillac insurance? And you've turned 65 and you go to the pharmacy to refill a prescription. And now they're saying the prescription, they're going to charge you more for that prescription because you're supposed to be on Medicare, but you don't have a supplement for the prescription. They charging you more.
No, that's a misconception. Okay. So as long as your spouse has Medicare equivalent, which the first prerequisites, they got to have 20 or more employees. Okay. Then you're having to pay whatever copay that the employer coverage provides. So I always tell people, whenever you're going to be turning 65 and your own employer coverage, give me a call and I'll ask for 2 pieces of information. And what I can do is compare the plan that you're on through the employer versus what it would cost you on an individual plan. So number 1, yes, you can stay on an employer plan as long as it's 20 or more employees and they have Medicare equivalent insurance and not get a penalty. I always like to start working with people 3 months before they turn 65 or 3 months before they're planning on retiring. That gives me ample time to help you through the entire process so you don't feel like you're going 90 miles an hour to rush and make a decision. I mean, I can go sliding in sideways and on 2 wheels with you. Okay, if you call me the night before and your insurance is ending the next day, but I don't like to. It doesn't cause me stress because I know exactly what's going to happen. I've done this a few times, okay? But it's going to cause the client a tremendous amount of stress. The other time people are Medicare eligible, however, though, are people that are under 65 and become disabled. So if you are diagnosed with ALS or with end-stage renal disease, then you become Medicare eligible immediately. If you have like an auto accident or fall at work or something like that, okay, and you have to be disabled for 24 months. And then in that 25th month, both the medical industry and Medicare assume you're not going to rehabilitate. So at that point, you qualify for Medicare also. So there's 3 times when you qualify. If you're under 65 and on disability, okay, if you're turning 65, or if you are retiring after 65, and all 3 times have different enrollment periods. So it's really important whenever you're going to become Medicare eligible to start working with a broker about 3 months before for the in a perfect world. Okay.
All right. I think that answered that question for them. I have one of the other questions is, if payments are tripled over time, why can't a person pay out of a penalty? I don't know if that makes sense.
Okay, so let's take an example. Say somebody didn't enroll in Part B whenever they became Medicare eligible, and now it's 3 years later and they're going, oh my God, I didn't know I had to be on Part B. Okay, so let's say 3 years ago, this year, okay, in 2021, Part B is $148.50. Last year, it was $145, and I can't remember what it was the year before. We'll just say it's $140 the year before, okay? So you're going to get a 10% penalty for each year that you didn't enroll in Part B, and you're going to have to pay that every month the rest of your life. So 3 years ago, if it was $140, 10%, that's $14. And then last year was $145. So that'll be $14.50 added to $14. So that's $28.50. And now this year it's $148.50. So then you would add another 14. So I don't know if somebody can do the math. Where's a man when you need him?
Right.
So 3 times 14 is 40, what, 42? So $42.50. So you'll pay $42.50 on top of whatever Part B is each year for the rest of your life in order to have Part B. So you see why it's really important to find out when to enroll in the different parts of Medicare. Now,
Okay.
for Part D, for the prescription drugs, it's 1% of the national average for each month that you don't have it. Well, the national average is about $35, so that'd be 35 cents. So if you didn't have insurance for those, I mean, if you didn't have a drug plan for those same 3 years, since we're using that as our scenario here, then you would pay 35 cents times 12 for a year times 3 for 3 years, or 35 cents times 36 months. And I cannot do that math in my head.
No, I get it.
Okay. And so you would have to pay that each month for the rest of your life. So remember, one of the first things I said, one of the most important things that I can stress is explaining these penalties and making sure that my clients don't incur one.
Absolutely. So another question that we have on social media here is, I am 1 year away from retirement. What are the steps I should take? Call Social Security office first, then Medicare, or will Social Security office connect me with Medicare?
Okay. I never call Social Security, the 800 number. I tell everybody to just do a Google search for a Social Security office near me, because those are the people that answer the phone. Okay. And remember, Social Security is money. You get a check, or not checks anymore, but they download money into your account. Okay. Medicare is insurance. Okay. Now, this is the confusing part about this. If you've started your Social Security, they will deduct your Part B only, just Part B as in baby, okay, from your Social Security. If you are delaying starting to get your Social Security, then they send you an invoice in the mail, and you have to pay your Part B as in baby quarterly. So people often forget that, even though I say things 3 times. I'm very repetitive whenever I'm enrolling somebody. Okay. I really want some certain points to for them to retain that, but they'll call me almost, or many times they'll call and say, I just got a bill for $400 and something. What's this all about? And I was like, remember Part B, and you're delaying Social Security. So as long as you delay Social Security, you have to pay your Part B quarterly. Once you start your Social Security, they will deduct it monthly.
Okay, very good. Lisa, you have some questions for Bonnie, please.
Wow, Bonnie, the information you're giving is so valuable. I mean, I had no idea. I'd always heard penalties, but I never really understood what that truly meant. And
Right.
that it was kind of in perpetuity. We understand that your services are free. So how can you do that?
Yeah, that's really a good question. So whenever we enroll someone, okay, well, first of all, I said at the beginning, we contract with all the major carriers, and some you probably never heard of before. Okay. So the insurance companies pay us a standardized commission. That way there's no incentive for us to write one plan over another. There's no bias at all. So that puts us in a position to compare all the plans available and put you on the best plan for you.
Great.
And there is no best plan blanket statement. Notice I said best plan for you, because a lot of times people will say, hey, my neighbor's on such and such plan and I want that plan because she really likes it. And I was like, Do you go to her doctors? You guys got the same lifestyle? You take her meds? There's so many different factors that I take into consideration. Hey, are you divorced from some guy that you get TRICARE from? So there's a lot of factors that I take into consideration. But so that's how we get paid, and there's no bias because, like I say, it's a standardized commission for all the companies.
So as far as, because you talk about reiterating, and it is such an overwhelming topic,
Yeah.
when you meet somebody and somebody says, what do I need? Why does everybody need to know about Medicare in the first place?
Well, the main reason is so you don't incur those lifelong penalties. That is the biggest thing. And then also understanding it, having someone that you work with explain in simple terms. And then one thing that I haven't touched on is sometimes people enroll in Medicare and they don't need to. I have a great story. This lady, 72 years old, okay, she called me up and she was like, my daughter knows you and I want to enroll in, I want to get a Medicare plan because I'm going to retire. And so she had signed up for Medicare when she turned 65, but she had a company plan. So
Wow.
she's paying Part B every month for 7 years.
Wow.
So do the math on this. Say it just averaged $135 a month. So times 12 times 7 years. How much money is that?
A lot.
And she can't get it back. It's like taking that money and blowing it to the wind.
Yeah.
That money is gone. This woman, she's single. She never made a lot of money in her lifetime. So how much money and how much could she have saved if she had just had one phone call to me? I mean, I could have saved her thousands, literally thousands of dollars. Another is I enrolled this one lady and her husband had died and she wanted to stay on the same plan that they had always been on because she thought that was the best plan, right? She was paying like $300 more than a plan that $300 a month, $300 a month more. Okay. So, y'all just tell folks to call us. Our goal is we want to make sure you don't get a penalty, put you on the best plan, get you as much coverage as we can.
Absolutely, Bonnie. We're getting close to the end of the hour right here. So do you have a call to action for our listeners today?
My thing is call us 3 months before you turn 65, 3 months before you are retiring after 65. As long as you have credible coverage, okay, if you're not sure if your company has credible coverage, okay, and you're turning 65, you can give us a call and we can help you ferret out that information. Or if you're under 65 and your own disability, you can give us a call and we can help you with that also.
So clarify 3 months after you turn 65. So if somebody's birthday is like March 30th, do they have until June 30th?
No, it's 3 months before. So say your birthday's March 30th. That's a good example.
Yes.
So count 3 months before. So that would be February, January, December.
Right.
Then the month is the month of March. Okay.
All right.
And one thing I'd like to say right here before I go on is regardless of which day of the month your birthday falls, your insurance is always going to start the first day of the month. So even if it's March the 30th, your insurance would start March the 1st. Okay. So back to answering your question, the month of, so it would be the month of March, the 3 months before, which would be December, January, February, and 3 months after, which would be April, May, and June.
Right. So you would have to the end of June. Okay.
Right. Yes.
Right. Absolutely. So how can people get a hold of you? Would you please give them phone number, email, website, anything you would like to give them, Bonnie? We'd love for you to tell our audience how they can get a hold of you, please.
Sure. My phone number at the office is 770-373-7541. My website is medicareandotherredtape.com. Or if you want to make it real simple, you can just go to bonniedobbs.com. I have 18 agents. We're in lots of different states, so we can help folks that are not just in Georgia. If you're moving into Georgia or moving out of Georgia, you definitely want to have your plan changed. That's one thing I didn't say though. If you're moving, please give us a call. It doesn't matter if you're moving to another state or another county. Your plan may not be good even in another county. That's another gotcha with Medicare.
So let me ask you this question. I have another question for you. So in signing up for Medicare, say that you live in Georgia, can somebody in another state with Social Security or Medicare sign you up in another state, or does it has to be in your state?
The plan has to be in the state and in your service area, not just the state, but also zip code and county that you're in. Okay.
Okay.
The agent can be anywhere as long as they are licensed and contracted with the carrier to.
No, I was referring to speaking to somebody in Social Security in their office. Could they, sign you up? Like in South Carolina, could they sign you up, or does it have to be in the state of Georgia?
I'm sorry, repeat the question one more time, sweetie.
So if you wanted just to sign up, say for a Part A or whatever, can you speak to somebody in the Social Security office in the state of South Carolina, but you live in Georgia? I'm giving that example.
Well, first of all, Social Security and Medicare is not going to, well, sometimes Medicare does enroll you in plans, but you don't want to do that. They're not going to enroll you in a plan, but since COVID, the Social Security offices, not all of them are open, as you know. Okay.
Right.
So I just tell everybody to Google the Social Security office near them. You may want to put your zip code in, or your city, or just Social Security office near me in the Google search, and then it'll bring the one up. I'm sorry, I thought your original question was, could an insurance agent in a different state enroll you in a Medicare plan in Georgia? And yes, they can.
Right. No, I knew that. I was just referring to that, maybe somebody has a connection or knows somebody that had a great experience in another state. Could they, use that Social Security office as opposed to the one, theirs, like, the office that I wanted to use where close to where I thought I lived. Now they want to give me an office over there in Norcross that I don't want to use. I don't want to talk to anybody in that office.
But I'm just trying to think about this. I don't know so much about that specifically. I just know that there's a couple of main Social Security offices around the Atlanta area. One of them, and it's over in Cobb County off Delk Road. So probably if you live on 75 on this side, that's where they would send you, or maybe within so many miles of that. And then they're probably designated by where you live as to which one that they would call you call.
Absolutely. Most important thing is what we've learned today is call a brokerage. Somebody like Bonnie Dobbs. Let Bonnie Dobbs help you, right?
Thank you very much. And I hope so, because I don't want anybody to get a penalty, and I want everybody to understand their plan.
Absolutely, Bonnie. And my husband and I definitely need to make our appointment because he turned 65 in June. So we're looking forward to, taking care of that. We're not nowhere ready to retire. We're too young to retire, even though we have to register for Medicare. We're continuing to work and stuff like that, but we do need to reach out to you. Lisa, what a pleasure to have you as our guest here today. Please tell our audience how they can get a hold of you if they'd like to have a conversation with you. All things social media.
Again, that's Lisa Parks. Probably the best way is just reach me on my phone, 678-687-8255. 9542. And thank you, Bonnie. I learned a tremendous amount just in this short period. Truly appreciate it.
Absolutely, Bonnie. What a great show here tonight. A lot of questions. And, again, reach out to Bonnie Dobbs, schedule that appointment. Don't go and do the runaround thing. You're going to call 10 different people. You're going to get 10 different answers. And as Bonnie said, don't compare yourself to what other people are doing. You're not in their shoes. It's not the same situation. You need a broker that you can have a one-on-one confidential conversation with that's going to guide you and direct you for the right thing. And Bonnie Dobbs, we thank you and look forward to having a conversation with you very soon.
Thank you for having me. This has been wonderful.
Absolutely. And in closing, we want to thank WCEG, Penny Rogers. We are coming up on this is our 1-year anniversary with WCEG for Sarah and I, and we are yes, it's been a privilege and honor to serve the WCEG community, and we thank you so very much. Have a wonderful and blessed day for each of you, and any other questions, continue to put your questions in there, and we'll make sure that Bonnie gets those questions and she can reach out directly to you. Have a blessed day, everybody. Thank you, Lisa. Thank you, Bonnie.
Thank you for having me.
Bye.
Bye-bye.